This presentation lasts around 4 minutes, the time it takes to run a mile, the time it takes a high-speed train to travel 10 kilometers, the time it takes 15 people to die from tuberculosis. 2 million people will die from TB this year because they couldn't get hold of the medicines to cure them of their disease. 15 of them while you are watching this presentation. The medicines to cure TB cost less than $10. They've been around for over 30 years. They can cure over 95% of people with TB when used properly. But these medicines are still denied to millions of people who need them. People need these medicines to live, yet only 1 in 4 people with TB receives treatment in a DOTS program. In March 2000, Ministers of Health, Finance and Planning and Development from 20 countries with the highest burdens of TB in the world met in Amsterdam to discuss ways of accelerating action to stop TB. The Amsterdam Declaration to Stop TB marks a turning point in the global battle against the disease, clearly laying out the key steps needed to combat tuberculosis. Exactly 1 year after the Amsterdam meeting, a new initiative was launched. Born on March 24, 2001, this new initiative is called the Global Drug Facility. The primary aim of the GDF is to help countries expand DOTS. With initial funding from the Canadian government, the GDF has resources to provide treatment for 500,000 people with TB. But this is far short of the money needed to provide drugs for the 10 million people the GDF aims to treat over the next 5 years. The list of countries benefiting from the work of GDF is growing. These drugs will make a difference, particularly in countries such as Somalia. Despite civil war, displaced populations and the lack of government, it has still been possible to provide TB control services through the collaboration of WHO, international organizations, NGOs and the community. And drugs are already on their way to countries. The first to receive GDF support was Moldova. GDF works because it focuses on partnership and responding rapidly to real needs. By focusing on equity and never losing sight of the main goal, and by harnessing new technologies. The GDF, through its procurement agent, EAPSO, uses a web-based system for placing and tracking orders. GDF in Geneva places an order to EAPSO in Copenhagen via the web, and within minutes, drugs can be ordered from the manufacturer in India. Countries can use the website to track their orders, or use email and fax to keep them informed. Though less than a year old, progress with the GDF has been rapid, ensuring a regular supply of high-quality TB drugs to countries which need them most. Drug prices have fallen by 1/3, so that a full course of treatment now costs less than $10. The GDF is one of the first tangible products of the Amsterdam Declaration and the first global facility focusing on access to drugs for diseases of poverty. GDF is also an excellent example of a small secretariat multiplying its impact with a wide range of partners. The GDF is managed by a small team in the Stop TB Partnership Secretariat in WHO in Geneva. GDF activities are overseen by the Stop TB Coordinating Board. EAPSO, the UNDP Interagency Procurement Services Office, manages drug procurement for GDF. To build on this success and provide drugs for 10 million people over the next 5 years, the GDF needs $250 million, a small price to pay. GDF matters because people's lives are at stake.